Good afternoon, ladies and gentlemen, dear colleagues. My name is Dr. Michael Klenze. I'm the Clinic Director of Tanyapura Integrative Health Center in Tanyapura, which is a part of the Tanyapura Sports and Mind Center and Hotel in Phuket in Thailand. Today I want to explain something which is, I think, very important for each and everybody of you. Maybe you doctor or may you be a patient. It's about genetic testing. What does it make this? You see this high performance athlete here on this picture. One of these is Mr. McCormick. In the middle, he is the Iron Man champion since many years, and you see him always very friendly. What does it make different from these two ones who already try and as well are using sports? The difference lies in the genes. The genes are the one who do the difference and tell you what makes you special. Since at the end the finding of the whole human genome in the Keystone Project, we know that we are different in many ways, which is based on about 30,000 human genes. All these genes have some little differences, which you can call mutations, but which makes all us so different. It's called polymorphism. Why should we do genetic testing? Let me explain. The current health situation in the world is very bad because of care policies and trends shows us that for the future, with the growth of the aging pyramid and the aging population percentage, we use more and more of our GDP. That means in total global economy, we are in a position where we can say we cannot go and treat rather sickness than prevent sickness. So prevention is the very important point, and to prevent you have to have a tool for this. And one of these very important tools is prediction. Prediction of diseases, prediction of response to medication, prediction of your metabolism to medication, hormones, and so on. That is why genetic testing is important. Genetic testing brought a lot of new things, and right now we are able to understand the whole DNA. Cracking the code in that time by these two gentlemen had brought us in this place where we are today, so we know how we can do this. To understand genetic testing, you have to understand the DNA. The DNA is a part of the chromosomes, as you see, and the chromosomes is a part of the nucleus, which you can see there upstairs. And this nucleus itself is involved in and has the entire genetic information. And if you go down to this and you smaller and smaller, you have the chromosomes and then you have the DNA, and our genetic information lies in this codification of the 4 different DNA bases, which give us a high quality of codification. So genetic testing measures actually the genetic basis of the DNA. The genetic test measures your DNA coding and measures the sequence of the different DNA bases. So if we want to see this, we have to see a DNA. We have to look on the DNA. A DNA is made of 2 strands, and every strand has letters. So that is A, T, G, T, and so on. These letters can make words. A, T, G, C, T, C, always 3 DNA bases make 1 word. If you put these words together, you have sentences. So these sentences are called gene. Actually, what the body is doing is nothing else than put all the information, how we are made, how our metabolism works, if we have green eyes or blue eyes or brown eyes, in these genes, what you see here. And one gene is a part of the DNA. So we have many genes here, and in the human DNA we have about, as we know, about 30,000 genes. A gene is made out of a part which is called control area. Then we have areas where the whole codification is going on, and we have a stop area. So when the DNA is read by another molecule which is called RNA, then this what we call transcription is for a special part of the DNA, so for the gene. So how does the whole machinery know that they have to stop this? They know this because they have a stop codon here. So if we do talk about polymorphisms, we have a nice wording for this. We call it small nuclear polymorphism, or SNP, just like SNP. And a SNP actually is defined as a single base change. So that means if we would have all the same DNA, we would all look like, work like, took the same length. But as I showed you in the beginning, there's a difference. The difference lies in the polymorphism. And the polymorphisms are the SNPs. And the SNPs are significant, little, small, tiny changes in the DNA sequence, which makes us a difference. I'll give you some facts. In human beings, 90.9% bases are the same. Only the remaining 0.1% makes a person unique. So there are different attributes, characteristic, and different traits. How a person looks, diseases, or develops diseases. These little variations, the so-called SNPs, can have an effect on the body which might be harmless or harmful, or even latent and comes out in later years. So a polymorphism has different consequences. Let's see on what it works. First, we can see your drug and hormone metabolism. That means what kind of drug you take, we know how the body responds, because it's different in everybody. If I'm a metabolizer and metabolize very fast, then I'm an extensive metabolizer. Or if I'm metabolize very slow, then I'm a poor metabolizer. The same as well for hormones, especially steroid hormones. We know the drug and hormone transports, which very important is because there's a big difference in how you can have and can respond to hormones and to drugs. We know receptor sensitivities, we know responder or non-responder, if you respond to a treatment or not. If you respond again for an antidepressive treatment or not. If you have an adverse drug reaction or not. If you have a risk for a disease or susceptible to a disease. So everything is in. Let's see a little statistic from some different sources, which gives us the idea why pharmacogenetics, for example, the consequence for looking for drug genetic response to drugs is so important. You must know that 1 in 15 British hospital admissions is due to adverse drug reactions. And that's why nobody looks for the genes and sees the genes before. 13% of German hospital admission is due to drug prescription adverse effects as well. 43,000 people die every year in Germany of the same cause. If we take the US, 106,000 patients die and 2.2 million are injured each year by adverse reaction to prescribed drugs. So there's a lot of outcome, is a lot of personal suffering, is a lot of fate in this, and is a lot of cost in this, which we can avoid when we do a right personalized medicine. We have to go down to personalized medicine. In the American and the US has, the president of the US has founded a council for science and technology, and they said that personalized medicine refers to the tailoring of medical treatment to specific characteristic of each patient. So that means every patient gets his own customized medication, customized supplements. In every patient we know what might be a risk factor for him for later years, and we can avoid by nutrition, diet, by exercise, and by mind training. So these leads us to the personalized therapy, and personalized therapy is an interdisciplinary challenge. That means every discipline in medicine is asked to take part in this. Response prediction is so important that we know meanwhile that even functional food are developed for this. You know, if you respond to omega-3 fatty acid in a good way or in a bad way, your genes tell you that. So that's the point why we have to go to this, and that we have to see what's happened. Here you see, for example, the response of diseases of some special medication in asthma and atherosclerosis. Even people, if they want to cease smoking, they have problems to cease smoking because they have a genetic variation in one gene here, which makes them to get greater craving or heart failure. We have disease susceptibility. We have genes which show exactly that you have a higher risk for blood pressure, you have a higher risk for atherosclerosis. You can have a higher risk for myocardial infarction, for Alzheimer's disease and cancer. And this we can see, and we can go through this, especially when we see here this wonderful image painting which is made by Raphael. This is Raphael's wife before she died, and she shows with her finger to the breast where is a breast cancer nodule, and this was the first painting actually done of breast cancer, and it's this painting is in Florence, and you see that the risk of breast cancer is even today in a big thing, and Angelina Jolie, everybody knows this, uses genetic testing to find out if she has a breast cancer, and she responded to this in a special things. How can you prevent this? I mean, the question is, when you ask me to go look for the cancer risk, then the first question will come, so how can I prevent this? And the prevention, you have some chemo prevention, you have directly some medications, you can do it by nutrition, you can do it by exercise. But in this case as well, like Angelina Jolie, what she preferred to do was a prophylactic surgery. She reduces the risk by 90% by mastectomy. You know. In psychiatry, we have the same. You know, every antidepressant has a very small window for treatment. So if you are a patient under antidepressants, you have to know if you have too much for you or too less. It doesn't work. If you have too much, you get crazy. So what can you do? You can do only one thing. You can follow the genetic. It tells you if you are a good metabolizer or a poor metabolizer. You know? So that's why the people are so upset with medication, psychiatric medication. They tell you depression hurts, but won't tell you antidepressant may kill. And there are a lot of disasters as well by antidepressant. Most of the people who did this very bad, shooting at the schools and so on, those patients were mostly people who were under antidepressants, so they were not in the right dosage. So they had overdose, so they were over maniac or low dose, underdose, so they could not do, and they responded to this situation that way. That led us to the situation from personalized medicine in psychiatry, which is very important. I will give you one example. There are two genes which I don't go too deep. There's a cytochrome P450 2D6 and 2C19. And if you see only one medication, it's called fluoxetine. Fluoxetine is converted to norfluoxetine and by an enzyme called CYP2D6. This is a way how it is to get out of the body. But if you see you have a poor metabolizer situation, then you start only with 70% of the dosage, not that one what is recommended from you from the doctor. If you are extensive metabolizer, you have to increase the dosage. So example, another thing is different countries. If you see people, Caucasians from Europe and United States, and compare them with Asians, Asians have a high frequency of mutant alleles of one gene which is called cytochrome P452C19, which is actually a genetic where you normally the extensive metabolizer, they can get off half of Valium or diazepam in 20 hours, while the poor metabolizers need 84 hours. I mean, this is a big situation. You see how different in different races and different areas of the global world the distribution is of poor metabolizers and extensive metabolizer. Actually, it's just a little saliva. You take just a little saliva from the mouth, from the mucosa membrane, and that will be checked. And at the end of the day, you have genetic testing, which gives you an early identification of your individual risk, give you more information at risk so you can escape your inherited fate through lifestyle changes, nutrition, as I told you, meditation and sports. You can provide specific dietary recommendation. We may also help you with predict response to therapy treatments, as I told you. We can indicate the need for early initiation of a treatment, and this additional information is thought to improve your compliance. Thank you very much.